Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. If you missed our live show, it is only available on our YouTube channel. What a fantastic conversation we had with Director 4 David Muntz, Sue Shade, around what's next in health IT. You can view it on our website with our new menu item, appropriately named Live, or just jump over to the YouTube channel. And while you're at it, you might as well subscribe to our YouTube channel and click on Get Notifications to get access to a bunch of content only available on our YouTube channel. Live will be a new monthly feature only available on YouTube. How many times did I say YouTube in that paragraph? Subscribe to YouTube. We're going to have some great stuff over there. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. Today's conversation is with Albert Oriol, the CIO for Rady's Children's Hospital in San Diego. Good afternoon, Albert. How are you doing?
I'm great, Bill. Thanks for having me here. How are you doing?
I'm doing pretty well. You are the 36th or 37th interview we've done. We usually do 2 shows a week. We've now done 1 a day for the last 4 or 5 weeks, and it's been great to talk to people in your role and just hear the amazing work that's going on. And let's just start there. I mean, give us a little context of what's going on in San Diego and what's going on specifically at Rady's.
Well, so I think overall San Diego with this kind of crazy novel coronavirus situation that we're all facing has overall done very well. I think our public health authorities got into this early on and set up all the kind of preventative measures that we've seen across the country. They jumped on it early on, as did the California governor, and we had been planning as well. So I think all in all, the region is doing great. The San Diego is doing great in terms of containing the threat, if you will, and Rady Children's is doing fantastic, both from an IT standpoint, but as well from an overall organizational standpoint, and it's been just incredibly uplifting to see how everybody's pulled together to plan and execute and get ready for something that, fingers crossed, we hope stays at bay, but that we're ready to tackle if and when it shows its teeth.
Yeah, so give me an idea of some of the things that you guys did. I noticed you're in the office. Did you really ramp up the work from home and the telehealth for a children's hospital?
Absolutely. So when the stay-at-home order came in San Diego and in California, so the schools I think announced on March March 10th or 13th or something like that they were not going to reopen for a while. So we put pedal to the metal to ramp up our work from home efforts. We went from having somewhere around 50 to 100 people working remotely at any given time to now having close to 2,000 people that work remotely on any given day, maybe even 2,500 that are working remotely. I think some of us are taking turns. We work some days from home, some days here. As you would expect, I have members of my team, both our biomedical engineering team as well as my end user services team, that the network team that need hands-on to continue to provide support, because the operations of the institution continue, and things break or things need to get installed, and they need to be here. And I think it's important for me to spend some time of my working week here to provide the support to do whatever I need. And the other days I work from home, and it works. It works great. It's a good balance, and I think we're going to see an interesting future when everything is said and done. But work from home, tremendously changed. I was asking one of my leaders earlier, how are we doing, for instance, on video conferencing? And what he was telling me is that on April, he just picked a day and happened to pick April Fool's Day last year. We, I think, did in total of 19,000 minutes of video conferencing. And that same day this year, we did 10 times that.
Oh gosh!
So
I've sat in that traffic in San Diego. I mean, do you think there's two questions really here. Do you think the work environment will change coming out of this? That's probably one question. I imagine some of your staff is going to be listening to this, so you might want to be careful how you answer. But the other question is, do you think consulting will change coming out of this? Do you think you'll think differently about consultants maybe, working on a project for you from New York or from somewhere else?
Great question. Thank you. So I think we have had a portion of our workforce that's worked remotely for years, and some of that has been because they've had life circumstances. As you know, San Diego has a big Navy and Marine presence, and a significant portion of our staff have spouses in the military, and they move every 3 years or whatnot. And so we've been rather flexible when it's come down to enabling people to work remotely, understanding that not everything can be done remotely, but we've been kind of on that bandwagon early. And what I anticipate is that is something that now will get augmented at some point. I don't know to what extent, but because we're having an opportunity or a necessity to stretch what we were doing beyond what we were doing, and we're seeing what areas actually work well and continue to work well, what areas are something that we can get by, but it's not ideal, and so I anticipate we'll see continued adjustment on that for a while when it gets back down to the new normal. And I think the same is true with consultants. We've used consultants remotely for a while as well. And what I can tell you is when I come to the office, my commute time has been cut in half, and that is just priceless.
Yeah. So give me an idea of how you worked with the other health systems. So you're in between Sharp, Scripps, UC, are all down there. I mean, that's pretty much most of the healthcare in that market. How did you work with them? I assume you worked pretty closely to talk about how the children's cases are going to be handled and coordinate that somewhat. I'm just curious how you worked with those other health systems.
Yeah, absolutely. So Rady Children's is both the safety net and the provider of choice for pediatric care in San Diego, and we take care of over 80% of the kids in the county. So for the most part, that traffic comes our way, regardless for the designated trauma center, etc. So we can already do that. We have a number of NICUs that are embedded inside the adult hospitals in the region. We have a pediatric unit also embedded in a local Sharp hospital, etc. So we partner. We like to say we're the Switzerland of pediatrics in San Diego, and we work very closely with all the all the adult health systems in the region. Now, for COVID, as you know, it's one of those blessings that the pediatric population seems to have been majorly spared, and so not that those kids with chronic conditions or some underlying conditions that make them susceptible are not at risk. They certainly are, but for the most part, I think, unlike other viruses, this is not one that is targeting kids, and so what we're doing is we've planned to be able to extend the age of people that we can care for, so that we can take over the younger adults if need be. If the surge presents in the adult hospitals, we'd be able to take on some of the younger adults here. But the reality is right now, like so many other health systems, certainly in San Diego, but in other areas of the country, volumes are low, and because I think everybody's being very responsible in managing the situation, we're not seeing the surge that is being seen in New York and some of the other areas, and so I just don't know when that capacity extension would need to be activated, just in case we're ready.
Yeah. So give us an idea on it. So it's This Week in Health IT. I'd be remiss if we didn't delve into this a little bit. What are some of the things that you did from a technology side that would be that people would be interested to, or even amazed that your team has been able to accomplish?
Yeah, well, I think like so many others, my team, I can't speak highly enough of them. It's just been an amazing sight to see how everybody's pulled together and kind of burned the candle on both ends of the stick to just enable this organization to continue to function. But I will tell you, the week after the stay-in-place, or the week when the stay-in-place order came through, our volumes just tanked, and it's been IT to the rescue to some extent, whereby we went from doing maybe a handful of telemedicine visits on a daily basis. We're now doing about 800 visits a day on telemedicine. So we're 75% of our ambulatory care right now is being provided through telemedicine. That equates to about 30 to 35% of our normal, what would have been our normal volume, but nonetheless, it's been a saving grace to continue to provide care for kids that need it. Right, one of the big concerns with this is that necessary care, whether it's vaccines or whether it's just monitoring of kids with chronic conditions, or checking to make sure that those who do need to come in rather than waiting for a condition to exacerbate, etc., that it gets caught early. That is being it's continuing to be enabled, right? So that's been brilliant. On the testing side, for instance, our Genomics Institute has stood up a testing, what we call a COVID mass testing that is available as a drive-through function, and so that's something else that we were able to stand up in record time and work through those processes, not only to be able to capture that information, but then to make results available to the county. So it's been just short of incredible. As I say, the collaboration across the house, the clinical, the logistics, the IT has been fantastic.
Yeah, that is fantastic. And we will have to have you back on the show. The things you guys are doing at Rady's around genomics is really exciting. I'd love to talk about that. And San Diego, I think, is one of those places that there's so much great stuff going on in healthcare. I just love to highlight that stuff. Thanks again for taking the time. I really appreciate you doing that. I love the mask too, by the way.
Yeah, thank you. Yeah, I'll try to not go rob a bank now.
Appreciate it. Take care.
All right. Thank you, Bill. It was nice talking to you. Thank you for having me.
That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email and let them know that you value and you are getting value out of the show. And also, don't forget to subscribe to our YouTube channel while you're at it. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.